We're talking about State Representative Carlos Guillermo Smith, back with us on the show, District 49 in Orlando. Hi there, Representative. Also, Andre Antenor, President and CEO of Positive Assistance, and welcome to you. And also Darius Lightsey, the HIV/AIDS Program Coordinator for the Florida Department of Health in Pinellas County. So, gentlemen, thank you so much. Welcome to In Focus. Such an important conversation. And I'm going to start with this because I know that in June of 2021 marked 40 years since the first group of AIDS cases were reported right here in the U.S. So, over the course, infections have since been reduced by 2/3. So, Andre, starting with you, is it safe to label this as progress?
Definitely not. So we are far behind and we need to step in. And that's one of the reasons positive assistance is in the game to contribute to reduce that. The statistic is unacceptable. So 2021, we need to make a difference. We need to make an impact. And that's where positive assistance come in.
And so, just this year then, the U.S. Department of Health and Human Services announced a pretty optimistic plan, and their hope is to reduce HIV infections by 90% by the year 2030. So, Representative Smith, just curious to know what you think about this plan, and does it account for the reality of these numbers?
Well, I think that it's an ambitious plan, and it's one that's certainly very welcome because it's so important for us to continue to put everything on the table because we have the capacity as a society to be able to eradicate HIV, especially certainly here in the United States, through so many of the breakthroughs that we have in modern medicine. But this is not something that the federal government can do all on its own. It's definitely incumbent on state governments and local governments as well to be able to play their part in reducing transmissions. Here in Florida, for example, unfortunately, we continue as the Sunshine State to see the most number of new HIV transmissions here in Florida than anywhere else in the country. We've seen a number of states have had high transmission rates of HIV, but they have taken steps to reduce those transmission rates substantially. But Florida has not really been able to substantially reduce this stubbornly high transmission rate. And one of the ways that I know that we can do this is by expanding access to Medicaid to make sure that all individuals have access to healthcare, because we know healthcare equity is an important issue here, but also expanding access to important medications that prevent the transmission of HIV, like PEP and PrEP, expanding needle exchange programs. We do have a few here in the state of Florida that are working very well, and also reducing the stigma of HIV, which is so pervasive even today in 2021 in an effort to really combat the spread of the virus.
And from that Health and Human Services plan that we're talking about, I do want to quote this goal of theirs. And it's, quote, "The U.S. will be a place where infections are prevented. Every person will know their status, and every person with HIV will have high quality health care." So, Darius, I imagine these efforts align with your daily work in the Department of Health. Hearing of an announcement then like that, are you seeing a connection for those goals on a local level?